get it?
Yes, it's recorded now.
All right. So, hi everyone. Welcome to another edition of Mentor Mondays. Today we're interviewing Dr. Amy Bethencourt.
Hello, everybody.
She is an OBGYN, a first year resident, and she works in Virginia. She attended Ross University. And today she's just going to talk to us about Hispanics in medicine and give us some info about women's health and reproductive.
Yep, let's do this.
Yeah. So, just a little background. Tell us about your transition from medical school to residency and like what it was like.
Okay, so going from a medical student to a resident, it's kind of shocking. It's exciting and scary, but definitely shocking. Because as a medical student, you don't make any calls. So you have somebody else behind you. You basically, even though you have some knowledge or the knowledge to make certain calls, um, it's not your responsibility, so it doesn't fall on you.
Right.
However, day one in residency, it's all you. Like, you are the doctor, the nurses are going to come to you, the patients are going to be trusting you, so it's a little bit scary at the beginning,
Mm-hmm.
and could be overwhelming, but just as exciting. So I usually tell people the story that the first day that I went to residency, my first day of residency, we were on sign out in the morning. When sign out was over, everybody went to their place, and I stayed back and I was looking around asking who's the junior managing the floor today. And they said that it was me. And I was like, no, it's not. And they were like, yes, it is. So I was like, oh my goodness, like, wait, hold on, I'm not ready. But you fall into the position, just be confident on your knowledge. Know that you have a team behind you of nurses watching and supporting you and your seniors all the time. Don't be scared to ask questions. Don't be scared to let your patients know, you know what, I need a minute, let me go speak to my team before you actually make a call, because their life is in your hands now. So it's okay to take your time to figure it out, but you'll do just fine. It
Oh,
just pushes you to become better and study harder and just, push yourself.
I'm so proud of you, Amy.
Oh, thank you. Can't wait till you're there. It's
I
so
know.
exciting.
Okay, so statistics have shown that the number of Hispanic physicians, and even, med students in America is tremendously low. Can you attest to that in your experience?
Yes. So I noticed that even in undergrad, even though there's like a fairly average Hispanic population in college, is not as large as other ethnicities. So I don't really know if I can pinpoint one particular reason why, but all I can think of is a lot of Hispanic come to this country living like terrible living conditions back at home. So
Right.
they come here, not everybody, but a lot, to just survive. So when you're here and your priorities is having food on your table, a roof over your head, sending money to your family, you're not necessarily concerned about a higher education. You're concerned about surviving. Also, your support system is key. My career is not my career. My career is my family's career, because they were there the whole entire time, pushing me hard every day. You can do this. Stop what you're doing. Quit your job and go to medical school. We got this. Don't worry. When you have a whole entire family depending on you for everything, you are not worried about this. Going to medical school is hard for everybody, but for somebody that doesn't really have the support from the community and their family they need, is exceptionally harder. So that's one of the things that I can think of, besides not having the necessary paperwork to be able to access just educational resources here.
Yeah.
As far as immigration status, it
Mm-hmm.
also doesn't help, because a lot of people, even though in some states and cities are allowed to go to college without being a legal immigrant, they're scared. They're
Yeah.
scared that if they do, somebody's come out is gonna come after them and send them back home or take their job away. So those are just a few things that I think um, don't let Hispanics necessarily seek higher education as much as other races.
That's definitely understandable.
Hmm.
So, what are some of the roadblocks and challenges that you think international medical graduates face when applying to your specialty and I guess some specialties in general?
I think that IMGs face a lot of challenges applying to any specialties, because there's there's a mentality here in the States that we are not as well prepared as US graduates. I'm not going back and thinking about how medical education is at home in the Dominican Republic. I can see how it's different. I'm not saying that they're not great. They're absolutely amazing physicians. They come out of school ready to handle everything. I would say even more so than us here in the States,
Mm-hmm.
because they have to deal with the clinical part of medicine still in medical school, and they're very hands on. But in contrast to US or even US Caribbean medical schools, they go from high school straight to medical school, and they don't really do undergrad. So their basic science is not as strong unless they like follow a curriculum like we do outside of medical school, like they personally look at that. So I think that affects a lot of how the United States thinks about IMGs, and they put us all together in a jar, whether we go to medical school in another country or it's a US IMG, which is the ones that follow the United States school curriculum.
Right.
But all I can say to that is that it doesn't make any sense in my head, because we take the same test
Mm-hmm.
and we go through residency just like everybody else does. So just if you are an IMG, work hard, show up, put the work in, have a positive attitude, be nice to everybody, and just show them that they're wrong. Show
Yeah,
them that we are just as good as everybody else,
can
and
do.
you'll be fine.
Mm-hmm. I'm telling you, chief resident in 3 years. I was
We
thinking.
will see. We'll see.
Okay, so you grew up in Dominican Republic. From
Yes.
your experience, and from your knowledge, what attention and resources are different in Dominican Republic in terms of women's health and reproductive health versus what you see here in America?
So, back at home, we have a lot of the same resources you can get in the United States as long as you have the money.
Hmm.
So, unfortunately, public health care is just not as good as it is here, not because of the doctors themselves, but just because of the resources that are available to people that cannot afford it.
Right.
Also, there's a lot of stigma connected to reproductive health, birth control, pregnancy termination. People don't really talk about that there, just because kind of like you're not supposed to.
Yeah.
It's kind of secret. The medicine practice, as far as like I can think 10 years ago, because I've been living here for 10 years,
Hmm.
was very paternalistic. So there's a lot of embarrassment connected to reproductive health, that women not necessarily seek medicine. So they try to do things like outside of healthcare, and then it doesn't go well all the time. And unfortunately, I don't know how we can necessarily help if the government is not backing us up.
Right.
So if you have the resources, you can get as good healthcare as you can here. If you don't, unfortunately, you can't.
Okay. And
Mhm.
is your dad still a physician?
Yes, he's still a physician back at home. And I was always with him
Hmm.
since I can remember, because he did house calls and everything, and you can definitely see the contrast in patients that come to him. Because I remember he would never turn down care to anybody. So if you couldn't afford it, but I also went to public hospitals there, and I saw the difference. And I have a lot of friends that went into medical school, and
Hmm.
over there, simple things like getting a cross, type and cross for
Yeah.
your blood. If
Uh-huh.
you don't have the money to pay up front for that, or you just don't do it, you die because you can't get a unit of blood, because
Oh,
it's not available. It's all about the money in a lot of places, not everywhere, and that's just really unfortunate.
yeah. Okay. So now we have some questions from our followers about information that they wanted.
Okay.
So the first question is, what effects do birth control have on young women? My daughter is 16 and she has just started birth control due to having heavy periods. She chose to have the depot shots.
Mm-hmm.
How long is it safe for her to be on the shots or birth control in general?
Okay. So birth control, just like any other medication or anything,
Mm-hmm.
does have some side effects. The more serious side effects are usually seen in women who are older, so after their mid 30s, women who have a past medical history of heart disease or stroke in themselves or their family, or women that are obese.
Okay.
And those side effects are usually a higher increase in stroke rate, in heart disease or heart attacks. But
Mm-hmm.
there's also a lot of benefits related to birth control, like it protects you against ovarian cancer, against endometrial cancer, etc. As far as teenagers, we don't really worry a lot about serious side effects. Most of the things that my patients are worried about is weight gain, which is related to birth control. Usually the ones that are that have has estrogen in them.
Mm-hmm.
Depo doesn't have estrogen, but it still causes some weight gain. And it's not the medicine itself that causes weight gain. It is that Depo and some other birth control stimulates the hunger center in your brain. So if I tell you, I'm going to give you this pill and it's going to make you more hungry, but if you control your diet, then you're not going to gain weight. You might gain a little bit of weight from water retention at some point in time, but that's also easy to lose. Sorry, I have my cat jumping on top of me.
Amy the
I'm so
cat,
sorry.
you guys.
I'm sorry. So that's one, weight gain. And with Depo itself, it is related to a decrease in bone mass
Mm-hmm.
in teenagers as well. The good thing about that is that it is 100% reversible. So when you stop Depo in a few months, your bone mass goes back to itself. There has, or I am not aware of any studies out there that are saying that there is a limited amount of time that you should be on birth control. As far as I know, it's safe for years and years and years.
Okay.
Hmm.
Perfect. Um, so with that being said, would you say that contraceptive methods, they are in general safe and appropriate for all adolescents of any age?
Yes, as long as they're healthy. I mean, there are things like if they have blood clotting disorders that in the that they carry, well, that carries a higher risk of throwing a blood clot,
Mhm.
and some other medical conditions that are not as common. If it's a relatively healthy individual, birth control is safe for them.
Okay. And so, next question, does long-term use of contraceptives affect the future fertility in teens?
No, not that I'm aware of. What I tell my patients is that birth control itself changes your cycle. It works by preventing ovulation. Okay? So your body kind of goes into another rhythm as far as ovulation. And after you stop birth control, if you're seeking to get pregnant, it may take some time for your body kind of like to get back in that rhythm that it was before,
Right.
because it's been suppressed for a certain amount of time that you took birth control. So going back to Depo, for Depo, it takes up to 1 year. Not necessarily in everybody. I mean, you might be the woman that misses one birth control month and you get
Right.
pregnant. But
Yeah.
some women take up to a year to regain their ovulation cycle to get back in rhythm and then be able to get pregnant. Um, Back in the days, a lot of people thought that birth control like affected fertility. You also have to keep in mind, if you already had a fertility problem before birth control, it's gonna come back after birth control. So it's not necessarily because you were on birth control that you're not fertile.
Hmm. Okay. So, can any type of oral contraceptive be used for emergency contraception?
Yes, even the combination pill, which is the one that you take once a day for a month, can be used for emergency contraception. I can't tell you for like how many you have to take. You have to take more than one, and it's based on what combination and concentration of the hormone is on the pill that you're taking. Oral contraceptive, the regular birth control pill, is not FDA approved for emergency contraception just yet, not because it's not safe, but because there are not really studies showing that it's as effective as the actual progestin pill, like Plan B, or there's another one that's Unipristol, I think it's called Ella, or even the copper IUD that if you put in even up to 5 days after unprotected intercourse, it can prevent pregnancy. So you can use other methods of birth control, as emergency pill, I can't tell you exactly how much to take because it depends on what pill you're taking. They may not be as effective, but they may work as emergency contraception.
Okay.
Mhm.
So, can oral contraceptives be safely prescribed to adolescents without a gynecological examination?
Um, yes. So as far as the gynecological examination depends on what you need. We don't need a pap smear to prescribe you for birth control. If you're under 21, we just won't do a pap smear. We may require a bimanual pelvic exam where we just kind of feel everything out. We look at your cervix, we feel your uterus if we can, and feel around for masses. But yes, it can be prescribed. It's based on the provider and your relationship with the provider and if they have a good medical history on the patient.
Perfect.
Mm-hmm.
Are there methods that are more or less appropriate for teens who have multiple partners versus those who have single partners?
So the only thing that I can say about that is that it seems like it's a question that's asking me about STDs. As far as birth control, there are not necessarily methods that are more appropriate to prevent pregnancy. For birth control, OBGYNs, we are kind of like going forwards to recommending the LARCs, the long-acting reversible contraceptive methods that are the implants. So IUDs or the next one on that goes in your arm, just because it's more effective in a way that you don't need to worry about taking a pill every day at the same time. So as far as compliance is better, but for STDs protection, if you are at a higher risk of contracting an STD, which is usually somebody who is have multiple sexual partners, or if their partners have multiple sexual partners, the only thing that would protect you against an STD is barrier contraception like condoms.
Right.
But
Okay.
for birth control, it's all the same. The most effective ones are the long-acting reversibles. That's the implants. But that has nothing to do with the how many sexual partners you have.
So, what factors do you think influence whether adolescents are use contraceptives effectively and are compliant? And how do you think doctors can facilitate like more consistency with their use?
I feel like if adolescents know how birth control works exactly and how it affects their body, they are better at compliance. Because I can give you a pill and tell you, hey, take it one day, once a day, every day at the same time, and you'll be like, cool. If I forget it, it's no big deal. But if I sit down with you and I tell you this is how it's gonna work, this is how it's gonna affect your body, and for it to be effective or the most effective, this is how you have to take it because if you don't, you're still at risk of getting pregnant. So if I tell you exactly how it is and you understand and are aware if you can keep up or not, it helps with compliance. Now, if you know that you're not good at taking pills, because I'm not good at taking pills, then I would totally recommend something that you don't need to worry about. Because
Right.
there's no use on me giving you a birth control that you have to take every day at the same time if I know you won't. Might as well not take it because your risk of getting pregnant are still high.
Hmm.
Not as high as if you were not on birth control, but still high. Hmm.
Yeah, so it's a lot of like having a good, I guess, rapport with your
Yeah,
patient so they
it's having a good
communicate.
rapport and understanding that because sometimes we forget that what is obvious to us is not obvious to the general population.
Right.
So understand that you need to sit down and break down everything in a very simple way so that your patients can work with you because you're a team. It's not only you telling them what to do. You need to it's a back and forth relationship.
Right. Okay. Do you think there are any interventions that could be effective in helping teens delay I guess, sexual intercourse?
So that goes back to education.
Mm.
That goes back to education, not only from a medical perspective, but from a family perspective. If
Right.
you're a mom or a dad or an aunt or a grandma or however it is that you're related, and you sit down with your teenager and talk to them and be like, listen, I'm not telling you what to do or I'm not telling you what not to do, but these are the consequences or this is what really happens if you're not aware of what you're doing, then I believe that it may not, but it may delay sexual initiation. And if it doesn't, it's okay to still keep an open communication because you know how to help your kid deal with all situations that they face. So
Right.
it's all about communication. I don't believe in just don't do it and let's not talk about it, because if you don't talk about it with them, they're going to get the information from the 13-year-old's friends that don't know what they're talking about,
Mhm.
and then you have a problem.
I agree. I also grew up in the Caribbean, and I remember that we didn't have those conversations.
No.
We
Mm-mm.
learned about it from biology class in high
Oh, well, you were lucky that you learned about it in biology, because there are some schools that don't even provide
Right.
sex ed, which is terrible because then they're misinformed. I mean, it's very, I'm not gonna say sad, but like you think about a lot of things when you go in and you see a patient that's 13 and pregnant, and
Yeah.
their parents sometimes don't support them, and or they're not there, or they're embarrassed. So it's like
Mm.
totally preventable. You know, you just need to talk. Just talking, that is all. My phone's going off. Okay.
Is there any relationship between age of pregnancy and abortion risks?
I have not read any studies about abortion risk based on age. I believe that if you get an abortion and you follow up medically appropriately and you do it professionally in a safe environment, the risks are lesser than if you don't. And you try to do some wives' tale method that you heard about from your friend. You know
Hmm.
what I mean?
Yeah.
So, typically, younger women are the ones that seek abortion just because it was an unplanned pregnancy. They don't necessarily have the support system from their family or the father of the baby.
Right.
But as far as risk, if you have a medical condition, then yes, you have higher risk. But if you seek appropriate medical attention, you should be safe.
Okay. Pain during sex. Is there something wrong with me?
Okay. That is a very, very, very general question.
I know.
Which for me to answer appropriately, I would need to have a lot more information, but I will do my best.
Hmm.
So I'm thinking, what's the age of this patient?
Right.
Is this a younger patient? Is this a patient that's new to sex? I would like to know about her background, her sexual initiation. Was there any history of sexual abuse? Are
Hmm.
we postmenopausal, where we suffer from vaginal atrophy because we're just not making any estrogen like we did before? So our tissue's different, doesn't tolerate the friction well enough. So these are all the things that I start just to think about when I hear about that question. So
Hmm.
is there something wrong with me? Potentially, yes. Um, is this patient Caribbean like we are? Are there stigma in their head
Hmm.
connected to sex? Are we having sex outside of marriage with this, which is not good
Hmm.
based on how you were raised or your community? So us women are different than men. We cannot always just do it. We need to be okay in our head. We need to be okay with it in our, and okay in our head, I mean like okay with the idea of having
Right.
sex
Hmm.
mentally. So if you have, I'm so sorry, my phone's still going off. If you have a mental predisposition of thinking that sex is bad, is going to reflect when you have sexual relationships. So that's my first thing that I want to say.
Hmm.
Open communication with your partner, okay? All the time. Have him or her do things that will get you in the mood. Talk about it before. Have him or her understand that they need to be patient with you. Because sometimes in the moment, you just, they
Yeah.
just want to get it done. And that just makes it worse for you. So that's one thing. Another thing, self-stimulation. If you can reach orgasm by masturbation, then you know that physiologically there's nothing necessarily wrong with you, but
Hmm.
it's more about up here. So those are all. There's a lot of things that come to my mind. You can have a medical condition that also could be treated with therapy and communication and patient with your partner. So, pain during sex, are you reaching orgasm? Are you not reaching orgasm? Do you have the desire of having sex? Do you not have it? So, it's like a very broad question. I need to know your age. I need to know where you
Right.
come from. I need to know your history. Do you have, again, a history of abuse? All of that stuff is going in my head. I
Yeah.
can't give you an exact
Mhm.
answer unless I know more. But there could be something wrong with you, that there are treatment that you can seek for. Just seek medical professionals and talk to your partner. That's the most important thing.
So
Do
it
I
could
did
be,
you get kind of like an answer to this question? Because that's a very broad question.
yeah, I guess what, Dr. Amy is trying to say that it could be a lot of things. It could be a biological issue.
Yes,
It could be mental, like
yes,
stress,
yes.
It could be just that you're too young. If it's your first time, then you're gonna experience some discomfort. It could be a
Mhm.
lot of things. So, like she said, it would be important to just follow up with a doctor, your personal
Yeah.
doctor, and talk to them, communicate.
Yeah, talk to your doctor, talk to your partner. Get if you are not lubricating, get lubricants. Like there's a lot of resources to help you get over that.
Mm-hmm.
You just have to talk to the right person. Do you get what I'm saying? I
Yeah,
know it
I
was a
get
lot of words
it. Yeah.
in that answer, but it's just a very, very broad question. There's
Mm-hmm.
not necessarily something wrong with you as a person,
Right.
but it's frustrating. I mean,
Yeah.
as providers, we want you to have a satisfying sexual life. So yes, we're here to help you. Come talk to us.
Mm-hmm. And then we can figure out if it's something wrong,
Yes, we
if
can
you
figure it out.
yeah.
Absolutely.
Okay, so this another broad question.
Hmm.
Should I be concerned about vaginal odor?
Yes. So if you have an odor that is different than, because some women just have a different odor based on the bacterial components of their vaginal floor or the bacteria that lives in your vagina. If you notice a change in odor or discharge, you should seek medical attention. It doesn't necessarily mean that you have an STD, but it can be something that's very, I mean, it's so common. It's like having a cold. It's called bacterial vaginosis.
Right.
So bacterial vaginosis is basically a imbalance of the normal bacteria in your vagina, where the things that usually live there, some of it grows above the level that we want it to, and may cause an odor and a discharge. Easy fix. 2 pills a day, 1 week, you're done. Okay, so that's the simplest thing that you can try for that. It could be an STD, which could be treated as well. So if you're concerned that there's been a change in your vaginal odor, go ahead and seek treatment. It's easy. No judgment here from us, okay? It happens more often than not.
Mm-hmm. Okay.
No douching. Don't be trying to do anything at home. That's weird because that makes it worse. Don't be putting nothing up in there that shouldn't be up in there. Okay?
Then you gotta let them know sometimes because they're
Yes.
very
Yes.
adventurous.
Just know that I heard from my friend that no, don't. Just it's so easy to fix with a pill. You don't need to be doing anything. Just go to your doctor and talk to them. One prescription and that's it.
Yeah, your OBGYN should be your best friend.
Yes, absolutely. Talk to us. This is what we're here for. We want to talk to you.
Mm-hmm. Okay. How often should I have a pelvic exam?
How often should you have a pelvic exam? If there's no abnormalities or anything going on with you, I would say that also depends on your provider. There are providers out there that like to do it once a year with your regular exam. Pelvic exam and pap smear is two different things. So that might be where the confusion is coming from. Pelvic exam may include a pap smear, may include a speculum exam, which is the clamp that we use to look at your cervix. Here comes the cat again. I'm sorry. Um, um, so I would say just a regular pelvic exam, provider based on what problems you have, once a year, maybe more often. If you're experiencing some gynecological issues, pap smear is based on age and previous pap smear results. We start at, woo, no, gotta get the cat down. Okay. Pap smears start at 21.
Mhm.
Okay. If your pap smear is normal, you are good to go for 3 years after 21. Um, you can get it once a year because some women just like to know that everything's going okay. Some insurances cover it for once a year. There are free clinics that I was just in one yesterday where women who necessarily didn't need it because they had it last year, but one that it went, they didn't have to pay for it. So if your pap smear is normal after 21, and you're not tested for the HPV virus, that's usually what we test during a pap smear, you're good to go for 3 years if it's normal. If we see any changes, then you might need one a year later, or you might need another one again for testing for STDs. If you're over 30, and we follow the guidelines where we test for just regular abnormalities in your cervix and the HPV, and they're both normal, you're good for 5 years. So the guidelines have changed a lot in the last few
Yeah.
years. If you ask your mom, she would tell you she needed a pap smear every year, where that's not the case anymore. Hmm.
Great. So now
And
we
which is great because nobody likes us when we go
have.
with the clamp up there.
Oof. Mm.
Yeah.
Okay, so these are more, I guess, social issues related. What do you think is the role of OBGYNs and physicians in dismantling rape culture? Do you think there is a role that they
Oh
can
yeah.
play?
I think everybody plays a role in that, not only physicians. Unfortunately, our society sometimes normalizes rape, places the blame on the woman,
Mhm.
and letting your patient know that it's never her fault, that it's always okay to talk to you, that there are resources out there to help her, whether it just happened, it happened 10 years ago, 5 years ago, 2 years ago, whether it was by her partner or a stranger. Like, it's always okay to talk about it. It's always okay to be open. It's always okay to let them know. The main thing that I see is that they normalize sexual assault and sexual abuse and sexual harassment, like, I'm a woman, that's just the way it is, or my husband was just frustrated because I wasn't feeling, so he's my husband, so it's okay. So it's good for us to just make our patients understand that it's never okay and that it's never their fault, and always maintain a good non-judgmental communication with your patient, and know that they have your support, because sometimes they don't feel like they have anybody else but you. So yes, we do play a role, I believe. I hope that I answered that question
You did.
appropriately. It's a very dense subject. I mean, we can be talking about that for hours.
I
But
know. Okay, so that looks like we covered everything. That was a
oh, yay.
that was a lot, but thank you so much for taking time.
You're welcome. I hope I answered everything appropriately. And if you need anything else, you can reach me. Whether we can video chat or not, I'm always available through messaging or emails.
Awesome. And as you all know, Amy is one of our mentors. We have her information on the site. So if
Yes,
anyone is interested in being a mentee, you can always just email us and
absolutely.
match you up with her. She's very busy though, but she always makes time.
Oh, I'll make time. I'll be better about that, I promise.
No, you're good. You're fine. We understand. So thank you again, and we'll be in touch,
Thank you.
okay?
Thank you for having me.
Bye.
I hope I answered all your questions, and take care of yourselves, okay? Come talk to us.
Okay.
Okay.